You're listening to Trax FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxfm.rtm@gmail.com. Like and follow us on social media at Trax FM Official.
Yes, Health on Trax comes on every Mondays in the second hour of Trax Momentum. And as Valerie just said in the promo earlier, 11:15 to 11:45. And if the conversation gets a bit more interesting, maybe we'll squeeze in maybe extra 5 or 10 minutes or so. Welcome, I'm your host, Anil on the mic. And Anil on the mic is not alone in the studios today. I'm joined by a pharmacist from the Kuala Lumpur Health Clinic, and she is Mak or Yun, and she's given me the privilege to address her as Yun this morning. Good morning, Yun, and welcome to Trax.
Good morning, Anil. So my name is Yun. Can call me Yun. I'm a pharmacist from the Ministry of Health Malaysia. It is definitely an honor to be here to share on the topic of HIV treatment.
Sure. Great. And yes, as I was mentioning earlier on in the break, today we're going to explore a very vital aspect of HIV management. And as the topic suggests as well, we're talking about HIV adherence and key to antiretroviral effectiveness. And I assume the pledge that we want to make in this conversation is, by the end of this conversation, we want to enlighten our listeners and alter their perspective on HIV, that, maybe there's a fallacy out there that is an incurable disease, or people who are infected with HIV might not be able to enjoy the quality of life just like every one of us, right? Whereas, as a matter of fact, there is treatment out there to oppress the viruses. I'll let you explain on that in detail, Yun. But first up, maybe you can give us an understanding and, enlighten us on what is HIV, and is there really a cure or not for the disease?
All right. Let me start with what is HIV. So according to the World Health Organization, known as WHO, HIV, which is the human immunodeficiency virus, is a virus that attacks the human body immune system, so it can weaken a person's ability to fight infections optimally, which eventually will progress into the last stage of HIV, which is known as AIDS. AIDS stands for Acquired Immune Deficiency Syndrome. HIV is easily transmitted through body fluids such as blood, semen, vaginal fluids, or breast milk. HIV can be spread through sexual contact, sharing needles among injecting drug users, transfusions of blood and organs contaminated with HIV virus, or from pregnant mothers to unborn children. So usually these occur before or during birth, or through breast milk. So is there a cure for HIV? Unfortunately, there's still no cure for HIV or AIDS.
Okay.
However, there are medicines called antiretroviral medicines,
right,
which can actually slow down the progression and complications of this disease.
Okay.
So the combination of at least 3 antiretroviral medicines to form an effective treatment package, we usually call it antiretroviral therapy. So in short, we call it ART sometimes.
ART.
Yes. So although this ART does not really cure HIV, but it can actually control the virus, means it suppresses the virus, stop it from multiplying in the body, and can reduce the number of virus in your body to the lowest level, or we call it undetectable level. Correct.
Okay.
So if, let's say, it maintains undetectable level, so the body immune function can recover on its own, as long as the virus is suppressed, as in stay dormant. So this treatment is actually available at selected government health clinics and most of the Ministry of Health, the MOH hospitals in Malaysia.
Okay.
So for further information on this, it can actually be found on the MOH official portal as well.
Okay, which is moh.gov.my as well.
Correct.
Right? Just to go back on how the HIV virus spreads, you mentioned through needle exchange, through intercourse, and so on. This is one phenomenon that's been bugging my mind, and I think I'm going to ask you this. Now, assuming a mosquito, all right, bites someone who is HIV positive, and that same mosquito goes and bites another person, does the virus spread that way, Yun?
As I know, no.
No, okay.
Yes.
Now we got...
No, it doesn't. it doesn't spread through food sharing.
Okay.
It doesn't spread through sneezing, coughing, skin contact, or sharing a place to live, work, or study, or through mosquito. No.
Mosquito. Okay,
Yes.
Okay. All right. Because the mosquito has got a needle-like top where it pierces it through our skins as well. So I always thought about that. Does a mosquito ever have the potential to carry the HIV virus? But now we know that that's a definite no-no. So, okay, that's fine. Now, I'm going to move on to my next question. Now, the need for very accurate follow-ups and strict discipline that is required by ART, as you mentioned, it necessitates for patients to be willing to, adhere to a very strict schedule. They have to be committed towards, taking the medication that is afforded to them. And, so what does this compliance actually entail, Yuen?
So, as mentioned earlier, HIV treatment will be provided as early as possible to every patient if the person is ready after a confirmed HIV diagnosis, and of course, there's no contraindication. So, why is lifelong commitment is always emphasized? I'll give you an analogy. You can imagine your body as a plant. So, HIV is a pest that will be always around. So, in order to defend your plant from the pest, so you need to constantly apply pest control, right? So, as long as you continue to take your medicine every day without fail, so it can continue to stop the virus from multiplying and to reduce the viral load to undetectable levels. So you need to, so patients will always be advised you should take your medicines every day, the same time, for as long as you live. And most importantly, to attend regular follow-ups, because these are part of monitoring to make sure the treatment is effective.
Okay.
Then, before starting treatment also, patients will always be explained on the importance of adhering to the treatment. So, as I mentioned just now, because you need to constantly apply pest control, right?
Yeah.
So, you need to constantly take your medicines without fail. So, to make sure patients are ready for this lifelong medicines commitment. And once the patient has agreed to start, so counseling will be given on the proper dosage of the medicines, proper timing of taking, how to take it, and also as well as the side effects to look out for.
Okay. So, Yuen, is ART necessary for as long as someone is HIV positive, or does can ART be stopped the moment the virus is non-reactive or non-detectable after a blood result test?
So last time, I think many years ago, so we can actually choose to delay treatment. Let's say, I have HIV, but I have no symptom. I feel very well. So why not? I can just delay my treatment. I can start later. But studies have shown that if you start early, means that let's say my immune system is actually quite well now, but I'm diagnosed with HIV. So if you start early, actually it can even increase your chances of survival and actually improve your quality of life so that you don't have to worry that your immune system will be eventually destroyed by the virus. So it's actually advisable to start as early as possible.
Okay.
And is there a way that, let's say I feel well now, so my immune system has recovered. So we have this monitoring parameter. We call it, there's a white cell.
Okay.
So we call it CD4 count. So if anyone that's familiar with the white cell count, so actually this will be monitored. So let's say the patient say, I've been taking this treatment for years.
Right.
So my viral load is undetectable now. Then my CD4 count, so the doctor say, wow, it has improved. Okay. Probably to near normal, or I feel fine, I got no infection, so can I stop the treatment? So as I mentioned just now, so there's no cure, so you can't kill the virus.
Yeah.
So what antiretroviral therapy does is they actually stop the virus from multiplying. So imagine it's a life cycle, right?
Right.
So the virus can only remain dormant if you continue to take the medicines regularly. So it must maintain as it such. If we stop it, so what will happen? So there's risk.
Yep.
Because if you suddenly stop the treatment, let's say I've been continuing on the treatment, so the virus cannot multiply as long as there's antiretroviral therapy. But what if, I feel fine, so I stop it? So there's a risk. The consequences can be drug resistance can occur. So what is drug resistance? Drug resistance means that the existing medicines are no longer effective to actually suppress the virus from multiplying in the body, which actually can lead to treatment failure. Means that you you've taken the medicines for some time, then you suddenly stop it. So resistance occur. If treatment failure to the standard regimen, then you might need to be switched to an alternative regimen, or we call it second line. So the second line actually comes at the expense of probably more serious side effects and even higher treatment costs.
Okay.
Therefore, we do not want all those to happen.
Right. Which actually, I was having another question in mind, but I think you answered that when I wanted to give our listeners a perspective on the term undetectable. And I think you answered it by saying that the moment the virus stops multiplying within the human body, when that is by itself a definition for it being... Am I right?
Yes. Undetectable is actually... undetectable in terms of the current detection method.
Right.
But it's actually still within your body.
Within your body, which is that it's not at the point where it's...
Correct.
Okay.
Not at the threshold that is detectable. But it's still there, lying dormant. So if, let's say you take out, imagine just now as the pest, right? So let's say we stop pest control. If we just let it free, so the pest comes back and multiply and attacks your immune system.
Right. Okay. Very interesting conversation that we're having right now. I'm speaking to Mak Wo Yun. She's a pharmacist at the Kuala Lumpur Health Clinic. And we're speaking about a very vital aspect of HIV management, which is adherence key to antiretroviral, ART as it's called in short, and its effectiveness. Let's take a quick break on Health on Tracks, and when we come back, we shall resume with the discussion. Keep it right here on Tracks Momentum with me, Anil, on the mic.
On Tracks will be back right after this. Worried about your health? Health on Tracks every Monday,
5 seconds.
11:15 to 11:45 a.m.
Good morning, everybody. Welcome back to Health on Tracks with me, Anil, on the mic. And my guest today in the studios is Mak Wo Yun. I'm calling her Yun throughout this conversation, and she's a pharmacist from the Kuala Lumpur Health Clinic. And today, Yun is talking to us about the adherence and the key to antiretroviral effectiveness, ART effectiveness for HIV-positive patients. Yeah, Yun, welcome back to Health on Tracks. Now, Yun, I just want to touch a little bit on getting tested or getting diagnosed of being HIV positive, right? Now, I want to go back before somebody gets tested. Who do you think should be going out there and getting themselves tested immediately based on the lifestyle that they're having? Who do you think are much more susceptible to it, and your advice to them to go out there and get tested first?
So according to the WHO as well, so individuals that are at increased risk of acquiring HIV are those who have inconsistent use of condom, means unsafe sexual practices,
right?
And probably those with spouse that are known to be HIV positive and does not practice safe sex as well, and those who are sharing needles, perhaps among injecting drug users, or maybe unlicensed tattoo practices. So those needles sharing that involve blood. So if you think that you are at risk of acquiring HIV, so you should get tested.
Right.
You can actually consult, you can actually walk into any of the selected government health clinics. One of them will be Kuala Lumpur Health Clinic to get yourself tested if you think you're at risk. And also to learn further about how to prevent HIV and to get more.
I think it's a very interesting point you mentioned there, because we often think that, HIV, like you mentioned, is a virus that's spread from, unprotected sex or sharing of needles. But hey, if you are someone who enjoys getting tattooed, you make sure your tattoo artist is using a brand new needle on you and not a needle that's been used by someone else, right? Which is why, they always advise when you go to a tattoo parlor, make sure your tattoo artist actually rips up a brand new needle for you before he starts tattooing on you. Right. And then now, supposing someone already gets tested, and then the big result drops onto their head, and, they find themselves positive. What do they do after that? Okay,
so usually if someone finds themselves positive, so what will be your first reaction? I think will be in denial. Probably this is not true. This is not happening to me. So some people might be in denial, as in, I felt well. I'm well. So I don't think I need anything yet. Okay, they might be in denial, but if possible, should seek treatment as soon as possible and or as early as possible, even though maybe past 3 months I was tested negative, but now I'm tested positive, means I probably at the earliest stage. So early stage means that I might feel well. I don't feel anything because my immune function is still not completely deficient.
Yeah.
So I felt well, but if we start treatment as early as possible, you have higher chance of living a close to normal life.
Right.
So yes,
the earlier the better, right?
the earlier the better. Correct.
Okay. See, that's one fallacy that you just debunked right now, that, if you are already infected with the virus, that's it. That's the end to your life. There's no way that you can enjoy life. You can't do the things that you once loved to do just because you're infected with the virus. And that, I think, has been partially responsible for draining down a lot of other people out there, because they lack the information that's afforded to them that, look, hey, don't worry. You can be HIV positive, but you can still live a normal life, because there's medication out there like ART, like we're talking about. Now let's talk about compliance now, Yun. Why is it, in your opinion, why do you think patients need to keep up with the instructions to, consume the ART medicines? And what are the risks that can actually occur from this if they don't adhere or don't comply to the strict regimented medicine guidelines that they're afforded to?
So the consequences of not complying means, as you say, I always miss, I'm not taking the antiretroviral medicine properly. So as I mentioned earlier, so drug resistance might occur. So this will lead to actually treatment failure, where we might need to switch to other regimen. So what is it important that we need to actually comply with the current standard treatment? So it is offered as the first choice. So it might be it will have lesser side effects as compared to our second choice or alternative treatment, and not at a higher cost. And most importantly, actually before starting treatment, patients will be asked to choose the exact timing where they can remember to take every day as a routine. So we try to stick to that timing every day if possible. For example, if the medicines are to be taken at night, so perhaps patient can choose a suitable timing before sleep, like let's say 10 p.m., so that they make it a habit to take the medicines at that particular time. So we have a few methods that can actually enforce that, so to make sure they remember. So first of that, the easiest way will be the use of alarm. So you set a reminder on alarm on your phone, the clock, or maybe on the watch, on your watch, to actually remind you. Like other options will be pill organizer, maybe taking off a calendar. So all this is very important so that you can stick to your schedule. You can remember every day at this time, I will remember to take my medicine. So as I mentioned, because every day if you take your medicine, so you will continue to stop the virus from multiplying.
Okay. So Yun, give us a picture on what is it like for someone who's on ART? How many tablets do they have to consume every day? How many times? Tell us about that.
So if, speaking on the perspective of Kuala Lumpur Health Clinic and most of the Ministry of Health hospital, our standard treatment, so usually consists of 2 pills.
Okay.
So, but the 2 pills will have 3 antiretroviral medicines, as I mentioned, because we need 3 antiretroviral medicines as a combination in order to be effective.
Right.
So that, because this can reduce the chances of the virus developing resistance towards any of each of the medicine. So we straight away combine 3 into 1, so to be more effective in stopping the virus from multiplying.
So 2 tablets a day.
2 tablets a day. So the usual standard regimen will be once a day only. And usually will be taken at night. So usually this is a standard treatment package. So will be 2 pills at night.
And what are some of the strategies, or what are the methods, apart from using their alarms or reminders, that you guys in MOH actually, come up with to ensure that people who've got HIV adhere and comply to taking their medications? So
another effective method I must mention is by engaging a family member or friend to be a treatment support buddy.
Right.
So what does treatment support buddy do? They probably can give patients a daily phone call, text, or even email reminder to take their medicines, so that because we know that good moral support by family members such as parents, siblings, or even spouse can be a strong encouragement for them to continue to take their medicines and comply with the treatment.
Okay.
So that's actually very important. And we even if let's say I do not want to let my family members, or I do not want to know, do not want to let any of my friends know. So we actually have peer support as well from non-governmental organization. So yes, it's all available if you come and seek treatment over at our health clinic.
Okay. Now, Yun, do you think that apart from ART, apart from, oral medication, psychological support is also necessary for these people?
Yes, definitely.
And in what way does MOH actually? Can you share anything about that? Do we have?
Probably, as this is the month of December, I would also like to mention that World AIDS Day, which was first introduced by WHO in 1988, is celebrated on the 1st of December every year as to raise awareness and understanding about HIV and AIDS.
Okay.
So this year theme was actually let communities lead. Means to increase involvement and encourage the participant of all parties to be equally responsible in efforts to prevent and control the spread of HIV or AIDS. So, if you happen to have family members or close friends diagnosed with HIV, you should be their support.
Okay.
Instead of being judgmental or have negative attitudes against them.
Absolutely. It all starts with the family in your close circle, right?
Yes.
Now, I'll just be a bit serendipitous right now, because I remember a couple of years ago, I was on the train. And in the train, in our MRTs, you got this small LCD panels, and you got these videos running around. And I saw this video of that featured a man, a man, I should say, who was speaking about the importance of taking ART. So he was speaking about that. So that was, I don't know, that was a couple of years ago. It was making its round in the trains, and it was speaking about how important ART was. And then he even admitted to saying that at one point he stopped taking ART because it made him feel really weak. It slowed him down a bit. I don't know, but it was his perspective, which alludes to my next question. What are some of the side effects? Are there any side effects that, drastically implicate the lifestyle or the quality of life of, HIV positive patients that probably pushes them to the brink of, I'm going to take a break from ARTs for some time?
So indeed, as with other treatments, ART also has its side effects. So depending on the type of antiretroviral medicines, some may cause temporary side effects such as headache, maybe dizziness, sleeping difficulties, or stomach discomfort such as nausea, vomiting, or diarrhea. But all this will eventually disappear when the patient's body adapts to it. So usually we will tell them this will happen in the first week or up to the fourth week, probably. So patient will always be reminded not to stop the medicines without consulting your doctor or your pharmacist, because all these are actually early side effects that will eventually it will go off. But if there are severe or prolonged side effects, like let's say they feel weak, lethargy, so it must not be ignored. They must seek direct guidance from healthcare professionals and do not attempt to stop the medicines on their own.
Right. Never self-diagnose. Always get the advice from an expert, right? Great. Let's take a quick break, Yun. When we come back, what we'll do is we'll dive into some of the determining factors that enhance maximize the results from taking ARTs, all right? Don't go anywhere, ladies and gentlemen. Health on Tracks will be back after a very short break. Keep it right here on Tracks Momentum.
Worried about your health? Health on Tracks every Monday, 11:15 to 11:45 a.m.
Good morning, everybody. Welcome back to Health on Tracks with me, your host, Anil, on the mic, and I'm joined by Makwo Yun. She is the pharmacist at the Kuala Lumpur Health Clinic, sitting right across me, across the DJ console. And today, Yun is actually speaking to us about the adherence and the keys to antiretroviral effectiveness. Yun, welcome back to Health on Tracks.
Thank you, Anil.
Welcome. Now, Yun, as we mentioned before the break, we wanted to talk about the factors that determine success in HIV treatments. Talk to us about that.
So the main factor in determining the success of HIV treatment, so as I keep on emphasizing, is the adherence towards the treatment. Adherence means you do not forget to take your pill every day and never miss. So there are other factors as well, such as if, let's say, low HIV viral load, as in if your HIV viral load, the starting is already very high. So you might take more time to actually suppress it. But how to avoid this means that you do get treatment as early as possible, not till you feel very sick, only you seek treatment after your diagnosis. So there are also other factors, but most important is still seek treatment as early as possible and stick to that.
Okay. Seek treatment as early as possible. Just
Yes.
stick to that. Okay. Now let's talk about another thing, stigma and taboo. I'm sure you do meet HIV patients on a day-to-day basis and prescribe medication for them. And maybe you might have had some very candid conversations with them. Would you mind sharing a few of their confessions to you, or their, when they confide in you and tell you about the stigma or the way they are judged by people on a day-to-day basis? How is it like in Malaysia out there?
Yes. Many people still have prejudice or negative attitudes about HIV.
Yeah.
So the social stigma actually labels HIV positive person as sinners, will actually cause them to be insulted, rejected, and most often gossip about. So people infected with HIV tend to feel nervous about telling others they have HIV, even sometimes to healthcare professionals. They tend to keep it to themselves, and this isolation will actually affect their motivation to continue treatment.
Yeah.
So, as I said just now, it wouldn't spread through sharing a place to live or work or even study. So there's actually no need to discriminate or isolate ourselves from those infected with HIV.
Okay. All right. And, before we let you go, I have to say that we had a very enlightening conversation today. You shared a lot of, very detailed, vital insights, and we understood really well about antiretroviral treatment. And there's, treatment out there to help suppress the virus that is infected into people who have been found as HIV positive. But Yun, before I let you go for the show, is there anything else that you wish to say?
So I want to mention that because ART treatment is effective to reduce the chances of spreading the virus to others. It can prolong survival and can improve the quality of life among people who are infected with HIV. But to ensure this, it is very important for patients to commit to their treatment and to continue to take their medicines without fail. So lastly, I also want to mention that please do not hesitate to call the National Pharmacy Call Center, which we call NPCC, through 1800-886722, which operates Monday to Friday from 8 a.m. till 5 p.m., except on public holidays. Should you have any inquiries regarding the proper use of medicines and also antiretrovirals.
Okay, so just to repeat that number again, 1-800-886722, yeah?
That's right.
1-800-886722 for any kind of advice that anyone needs on how to take medication the right way for whatever that they're facing, yeah?
Correct.
Okay. Mak Wo Yun, thank you very much for setting aside your time this morning and being with us here on Health on Tracks. It was a great conversation. I wish you nothing but the best. Merry Christmas in advance to you, and I wish you a pleasant Monday ahead. Thank you.
Thank you for having me. It's a pleasure to be here. Merry Christmas to all of you as well.
Likewise.
You're listening to Trax FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxfm.rtm@gmail.com. Like and follow us on social media at TraxFMOfficial. You're listening to Trax FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxfm.rtm@gmail.com. Like and follow us on social media at TraxFMOfficial.